Hi, this is Kenny, the co-founder of Aiskyra. I'm going to demonstrate an advanced feature that Aiskyra has as part of our AI drug information assistant. That is the ability to upload multiple files and analyze them in the context of Aiskyra's custom drug information database. So we've actually curated our own drug information database using credible medical references such as Health Canada product monographs, clinical practice guidelines from Canada, United States, and international guidelines, as well as clinical pearls and tips, and finally, millions of articles from PubMed scientific literature. So when a clinician asks a question, they will get an evidence-based, fully cited answer. When combined with patient-level data, within seconds you can get specific patient-level insights that would be tied to best practices. On Aiskyra, you can click the upload button. Files can be PDF, text, PowerPoint, images, audio, video. There are some limitations that we have set for now, but for enterprise use, they will be much more flexible. So I'm going to upload this sample medication chart. Mr. Chen is taking Altace 1.25 milligrams, Captopril 25 milligrams, Eliquis, aspirin, celecoxib, lisinopril, metformin, and Jardiance. So you can see that there are already some potential drug therapy problems and drug-drug interactions, which we'll get into later. I'm also uploading this basic patient profile with their age and weight. I'm going to also upload this simple clinic note that says their eGFR is 35. So now we have 3 uploaded images. I'm simply going to ask, are there any serious drug-drug interactions? So what's going on in the background is Aiskyra is reading every single document, extracting text from it using our optical character recognition technology, and then it's going to feed that information to Aiskyra's AI drug information database to provide specific patient-level insights. Just to double check, the summary of the question is at the top. I'm asking about drug-drug interactions for a medication list, so it's correctly read all of the drugs: Altace, Captopril, lisinopril, Eliquis, aspirin, Celebrex, metformin, and Jardiance. It's also correctly identified the clinical note, which said the eGFR is 35. So let's take a look at the clinical discussion. So pretty obvious that there are some significant clinical concerns. The first one and most obvious one is a triple therapy of an ACE inhibitor. You can see that it refers to the fact that the triple ACE inhibitor combination has an severe increased risk of hypotension, hyperkalemia, as well as acute kidney injury. This is especially dangerous in a patient with an eGFR of 35. Because the renal function is already compromised. Secondly, we can also look at the combination of NSAIDs plus an anticoagulant such as aspirin and apixaban, which causes increased risk of bleeding. So use of the NSAID we'd have to check whether the NSAID is worth the benefit compared to the risk. Also, there are some renal considerations for a patient with an eGFR of 35. You can see metformin is mentioned here. Now, the patient is on a pretty low dose of metformin, so it may not be something that needs to be adjusted, but may need to be monitored. Similarly, Jardiance can be used in low renal function. And lastly, there are some monitoring parameters because of the use of ACE inhibitors, and you would monitor their serum creatinine and potassium. At the very end, there are therapeutic alternatives and considerations for the triple therapy of ACE inhibitors. Really, the answer is consolidated to a single appropriate ACE inhibitor or an ARB. For the Celebrex, due to the potential for bleeding, you want to consider safer pain management alternatives like acetaminophen. And there are a number of cited sources, and they correspond with the references list here if you want to do more reading. I'm actually also going to ask a follow-up question. What vaccines should patient receive? Besides drug product monographs, we also have information from NACI, as well as the Canadian Immunization Guide, to help inform this answer. So Aiskyra has calculated that the patient is 61 years old, likely have type 2 diabetes, likely have chronic kidney disease, and what kind of vaccinations can they benefit from? Influenza is an obvious recommendation, pneumococcal, Shingrix or herpes zoster, Tdap, COVID vaccination. Now let's ask a follow-up question about RSV. Patient is being admitted to long-term care. Do they need RSV? In the clinic note, and in the patient profile, there's no mention that Mr. Chen is entering long-term care. It was assumed that he is a community-based 61-year-old male. So now that we've added additional context, let's see what the answer is. So the clinical discussion is that RSV poses significant risk of severe outcomes for older adults. And you see that NACI has specific guidance for use of RSV in certain categories of patients, specifically an adult 60 years of age and older who's a resident of a nursing home or other chronic care facilities. It is a strong recommendation to get an RSV vaccine. The RSV vaccination options are listed here, as well as the schedule or timing of the medication. There are additional considerations as this patient has diabetes and chronic kidney disease. Very strongly, they need the RSV vaccination. There's also other safety and administration considerations, potential contraindications, monitoring, as well as co-administration with other vaccinations. Finally, a summary of vaccine alternatives, as well as the references. You can see that it has mostly pulled information from NACI and the Canadian Immunization Guide. And if I were to click any of them, I can do more reading myself. And I can continue to ask further follow-up questions. So overall, with Aiskyra's AI Drug Information Assistant, you can upload multiple types of documents. It could be an image, it could be an impression of a lab, it could be lab results, it could be a medication history or medication chart. And you can use Aiskyra to make patient-specific queries and get patient-level insights without actually typing in the patient characteristics and patient details. With a little bit of customization, Aiskyra can also create workflows from this knowledge. If you have any questions, reach out to us, hello@aiskyra.com.